Real quick question: How many of you, by a show of hands, were here in the summer of 2009 when Jonah Froelich put together, when he was at CHHS, when he put together a summit on EHRs, HIA, and everything? Raise your hand if you were here. Not so bad. It's almost like a reunion, and we see some old faces. But what I think what's really exciting is there are a number of people that weren't here in 2009 that are here today. So there's been a great movement towards activity towards supporting electronic health record adoption, health information exchange, and telehealth. Before I begin, I have my presentation up. I wanted to, let me go get it. Since a lot of you I'm familiar with, I wanted to share something. I finally, as a guy, turned a certain age, and I said, yeah, I need to go get a physical. So I went and got a physical. No, I'm not going to show anything obnoxious. But they said, hey, you're kind of going blind because you're not, I said, yeah, it's kind of fuzzy at night reading. So I finally got glasses. And I've had this fear of putting on glasses. So I thought, what better place to put on glasses and see how it would look with some of my old friends and some of my new friends, because I might be wearing these glasses more and more. So just take a deep breath and tell me what you think. Is it okay? Yeah. Oh, wow. Handsome crowd. Very nice. Okay. So I'm going to try this. My wife picked him out, so yeah, if she likes it, I'm okay. So I'm going to present to you something about, not just about innovation, but something practical we're doing in Los Angeles. And let me get the clicker here. And I think innovation has been, it's been really big. So first, for those of you who are new, my name is Sajid Ahmed, and I'm the Director of Health IT, and I changed my title to have the cool innovation word to it. And I think if it gets cooler, well, I'll put innovation first, and then and Health IT afterwards. And it becomes even cooler, well, if LA Care lets me, maybe I'll be President of Innovation. We'll see. So this guy, you guys probably, some of you may know, this is Guy Kawasaki. He came up with a very cool principle called, build something before people know it. And this was his definition of innovation. And, not so bad. And Apple's been known to come up with some great innovations like the iPad. One interesting thing that you should know about the iPad is in 2004, I was reading an article by Lisa Landro in the Wall Street Journal, and she had a statistic. This is 2004, which read that 23% of doctors' offices, less than 23, had even a computer in their office. The reason I mention it is earlier this year I was reading an article about the iPad, and it struck me when I read almost the same sentence, except it said 23% of iPad users or iPad purchasers right now are physicians. So in a span of 7 years or less, we've had such a great shift in adoption of technology. So I think usability and innovation are a big player in what we're doing. So I'm going to talk to you about eConsult specifically. And eConsult needs a definition. For us in Los Angeles, it has a number of definitions. It's not the patient emailing or doing an e-visit with a physician. It's a physician talking to a physician, peer-to-peer communication. It can also be known as also a process, and it is a technology. And I'll get to the process part in a little bit. On a very basic level, it's an electronic curbside consult to allow physicians, especially solo and small practice docs in primary care settings who don't have that staff model, to collegiately reach out to a specialist and say, hey, I've got a patient that's showing something, can you help me out? Ultimately, we settled on this definition. It's a peer-to-peer communication and referral management system. And that referral management system is the piece I'm going to talk about very shortly. I wanted to put eConsult in the context of where it belongs. In the paradigm at LA Care that I've had a chance to come up with, and with help from Jonah Froelich and his team at Manette, we've put it together as there's electronic health records, you've got HIEs, and you've got telehealth. You need those three technologies together to create a foundation of care coordination and communication. They make up health IT. And that's really about creating, well, from a plan perspective, member wellness, but really quality care for the patient. And eConsult is really a telehealth technology, store and forward, email, chat-like communication. So what is it? How does it work? What's the problem? Well, this is how it works. It's very simple. You have a PCP that needs to make a referral for specialty care access. They initiate an eConsult. A PCP reviewer, a specialist reviewer responds to that eConsult and determines whether there's a need for a face-to-face visit based on that eConsult clinical question, or if there's something that the specialist can respond back with some education back to the PCP, giving the PCP a chance to provide care. And the goals of it were very simple: improve timeliness, improve access to care, and improve efficiency. And from a plan, or health plan, or from any healthcare delivery network, you really want to reduce unnecessary visits. And there's a very key statistic that I'm going to mention that seems to be consistent in these types of eConsult implementation, which is we ran a pilot before launching our program that I'm about to introduce to you that basically revealed that up to 48% of eConsult resulted in a deferred visit, meaning that a visit was not necessary. Either the specialist said there's no need for a specialist visit, or they provided education and treatment options back to the PCP. So obviously the problems we're addressing are twofold: one for the patient, one for the provider. For the patient, it's really about long wait times for specialty care access. I'm not proud to say this, and I don't mean to dismiss anybody that's here from LA County, but LA County Department of Health Services has approved referrals dating back to 2007. They have 26,000 approved referrals waiting to get appointments. So it's a huge problem here in Los Angeles that we're tackling. For the providers, you know, there's no typed note. They don't know what's written. They may, if they're lucky, they get something that's legible. So what eConsult addresses are all those needs. And right now, this is one of the methods that I think a lot of you are familiar. There's that fax that says, you know, I've got a patient, I need a referral, it's hardly legible. So, you know, these are the problems. You know, there's supply problems, there's a need, all the things I mentioned before. But what I want to hit is what it really looks like from an enterprise-wide approach. So imagine you're one PCP site and you need to make referrals to whatever specialties. So that's what it looks like when you make a referral. So let's say, you know, this is talking about LA County DHS, Department of Health Services. You have multiple sites. And so as you look at it from a system, that's what it looks like. It's a complete mess. When you look at it as a process, all those arrows, that's the referral process that was captured when we did our assessment. For clinics, clinics doing referrals into specialty care. It's a mess. It's like telling Cookie Monster, you have to eat fruit now. You know, he's not going to like it. So providers really just want to provide care. I just threw that in to make sure you were paying attention after those fun slides. But really, we went in and said, let's clean it up. Let's clean up the referral process, both from technically as well as process-wise. And it's very important. The process is the key, not the technology. As we used to say, it's not really about the HIT, it's about the process. Well, this cartoon kind of exemplifies that we don't want to stick something with a provider where they're constantly, you know, checking to see if they're following the technical flow, or even in this case, the meaningful use flow. You know, check. You know, he's not even looking at the patient, and that's not a too far-fetched. Many providers are being asked in their training on EHRs to position themselves where they are able to look at a patient and not just at the screen. So all of this has led to the launch of our Safety Net eConsult program in Los Angeles County, and these are the bullet points. LA Care is acting as a project manager, and we funded it through our community benefits program for up to $1.5 million. So it's real dollars. For up to 18 months, we're going to do the development, testing, and deployment and training for up to 30 Safety Net clinics and up to 21 Department of Health Services sites. We're going to replace the current LA County Department of Health System's referral system. So there will no longer be referrals in the traditional sense. There will be eConsults done. eConsults being specialty care access provided through telehealth. And I think that's very important. And we're also connecting eConsult into EasyCap and other authorization systems to manage the managed care population, which is great. And these are our partners: LA County DHS, the Community Clinic Association, Healthcare LA IPA, MedPoint Management, which is the MSO that supports Healthcare LA IPA, and LA Care. And ultimately, the numerous physicians, their staff, the specialty reviewers, and the specialists who will see the patients, they make up the foundation. And that's my staff trying to create an earthy icon for foundation. But that's what's going to make it. But at the very top, it's going to take coordination and collaboration and support. And I mentioned Guy Kawasaki earlier, who mentioned, that there's to innovate, you've got to really build something before people know what they build. But I want to give a shout out to a friend who said, we really need to work together and collaborate on stuff, even on innovation. And this was done by Jonah Froelich. I just happened to find that picture, so Jonah, I hope you don't mind. There you are. Notice, no glasses, so an advantage. So eConsult, basically, we launched it this summer. We've been in the news. It's gotten around. And the reason I bring this up is, even though we think we're doing something innovative, this was already being done in Australia, in Canada, and Nigeria. It's also being done in parts of the United States. I have a Twitter account, by the way, but I'm not here to tell you what it is because I don't know what it is either. I've tweeted twice. One was hello, and the other one was, faxes are dead, eConsult is it. Evidently, LA Care was watching me. I didn't know they were. And they retweeted it, and our board of supervisor, Don Kanambi, picked it up and tweeted it out again. So I think it's going viral. And don't take my word for it. Yeah, I know. Well, that might be the end of my presentation, so I'll let you look at my tweet. Let's see if I can get this going. Oh, that's it? That's it? I run out of time? And you stop my presentation? I'm a sponsor. Anyway. Well, my presentation's working here. What I wanted to say is the other slides show the Commonwealth Fund also just did their study on e-consultation between specialists and primary care and realized around a 50% savings. The Oklahoma prison system, oh, there they are, thanks. Oh, yeah, you can go to the next slide. The Oklahoma prison system also has effectively used e-consultation. So these are things you can find. Next slide. And I'm actually towards the end. Ultimately, it's about the patients. We always forget, and I like that in the collaborative model that the state has. There's now a big bubble for patients. That's really about patients. One more slide, a couple more slides. Let's see, one more. So I want to end on this. Another great way to innovate is to borrow or to steal. So you're more than welcome to steal this. And I put this out with Steve Jobs because I think we had a passing of a great innovator. And a lot of people think he invented stuff that we didn't know we need, and he just made it great. But he also stole. He stole from, I think if you guys know the story, he stole from Bell Labs about the mouse, and he stole the Windows idea from Bill, or maybe vice versa. But I think that's very important that we look at what we're doing here and borrow and steal from each other. One more slide, I think I have. Let's see what I want to end. Oh, that's my name. That's it. Yeah, I'm done. So thank you very much.